Hi, my name's Stuart Murray. I'm a psychologist specialising in the treatment of muscle dysmorphia and male body image concerns. I'd just like to talk to you guys for a few moments for anybody who's worried that they or someone they know may be becoming increasingly concerned about their body and how muscular they are. Did you know most guys and most boys, when they're dissatisfied with their body, they desire a bigger and more muscular physique rather than a slimmer and a more slight physique, as most of us would come to assume. Some boys and some guys, when they're really dissatisfied with their body and how muscular they are, they can develop what's called muscle dysmorphia or bigorexia, or in some cases it's known as reverse anorexia nervosa. As the name suggests, this is a condition in which boys, a bit like girls do in anorexia nervosa, come to see their body in a different way to how it's perceived by other people. And boys see their body as insufficiently muscular, so they really look at themselves in the mirror and think they're not muscly enough, and that causes them a really big amount of shame and distress and hurt. Now, not many people know about this condition, and it's actually quite a serious condition that can result in some pretty harmful effects. So I think it's really important that I take some time just to tell you a little bit about it, given that it's most common in boys, and particularly athletes and boys who play sports. The most striking feature of muscle dysmorphia is, quite simply put, it's a belief that one's not big enough, and that doesn't matter how big they actually are. And in many cases, people with muscle dysmorphia who think they're really, really small have friends and family members and teammates telling them they're actually really big, and when they look in the mirror they tell themselves that they're really small, and they focus only on areas that they can improve, telling themselves that they're small and insufficiently muscular. And these thoughts can happen for up to 5 hours a day, and they can make stuff like concentrating on school or the movies or Facebook, it can distract you from almost anything, and it causes a lot of distress. Another feature of muscle dysmorphia or bigorexia is a really intense training regime, and guys with muscle dysmorphia are often really, really scared to not train or to miss a training session because they're really worried that they might lose muscular size or become small overnight. And so we often see guys and boys who have really bad injuries and they just can't stop training because they're really worried about what will happen to their body if they miss even one day. Another feature of muscle dysmorphia connected to this really strict training regime is that the training regime takes really central importance in one's day. And so boys often give up invitations to parties, to dinners, to the movies, things that they would typically enjoy doing because they don't want to miss a training regime, and that really becomes the centre and the most important part of their day. Another really important part of muscle dysmorphia is the diet and the eating part of this illness. And boys usually become really, really worried about what it is they're eating and that they're not getting the right amount of nutrients so that they can carry on getting bigger muscles. Now this normally involves counting protein, and boys often become fixated on checking the labels of foods they're eating, calculating the protein content, weighing themselves, and eating every few hours, even if they're not hungry sometimes, just so that they can make sure their body stays topped up with enough fuel to keep growing. And they worry that not eating means they might actually become smaller. A further way in which the diet or the eating component impacts boys with muscle dysmorphia is that they can't eat out at restaurants, even though they may like to. Boys often worry that what it is that's being served up in the restaurant isn't pure enough, and it's not high enough in protein or nutrients to make sure their muscles are going to carry on growing, and that causes them to really, really worry, and in some cases just not go to restaurants. Another feature of muscle dysmorphia, and one that you might be able to imagine, is if somebody is worrying all the time about themselves being really small, is checking their body. And guys with muscle dysmorphia really check their body and check their level of muscularity quite a lot each day. Now that can be standing in front of the mirror and checking and flexing. It can be walking past cars or shop windows and looking how their muscles look. It can also be a little bit different, and it can actually be asking people if they think they look big, or if they've lost size even. They might ask you to reassure them that they've not got any smaller. Another feature of muscle dysmorphia is quite simply body avoidance. As you can imagine, guys who do think they're really small, they feel quite ashamed of it sometimes, and so that causes them to try and avoid showing their body. So this may look like a guy who's actually quite muscular, being very shy around being seen with their shirt off in the changing room, or going to the beach in all their clothes, or trying as hard as they can to avoid showing their body, because really inside they're worried that people may think they're too small. One of the most dangerous features of muscle dysmorphia is the direct link between this illness and anabolic steroid use. Now, anabolic steroid use is linked with a whole host of physical, medical, emotional and psychological complications, which in some cases can be deadly, and this is directly linked with muscle dysmorphia. Usually males with muscle dysmorphia take these drugs to try and get bigger, and somebody with muscle dysmorphia may never be able to say that they're big enough, and they will always believe that they are inadequately muscular, that they're not big enough, and so that drives them to often keep using steroids, and it can develop into abuse, which, as I say, is often very dangerous. So those are some of the main features of muscle dysmorphia. If you're worried that someone you know, someone you play a sport with, or you yourself have some of the features of this condition, I really recommend that you just speak to someone and get this checked out, because, as I say, not many people know about it, and quite a lot of people think it's a good thing to try and sort of be as muscular as you can, but it's actually really dangerous, and there's a lot of shame and there's a lot of emotional pain involved in this illness, and it can result in some real physical complications as well. So I'd really recommend that anybody having features of this to really get checked out as soon as they can with their GP or a local psychologist.